everyone here to, as we recover in our economy, work on our Rhode Island 2030 plan, and interacting. And of course, I'm looking forward to getting to the gym, getting to see a couple basketball games down here, right? So, so President, thank you, and it's again great to be here at URI. First, it's the second day of move-in here in at the University of Rhode Island, and that's an event, right? Who thought that we would be backing in a classroom completely on all our universities in the state of Rhode Island, and the University of Rhode Island is providing the lead here in talking about the vaccination rate of its student body, and now that notice today that yesterday that the faculty is going to be vaccinated as well, and there's an agreement to do that as we're working around the state to make that happen in all different settings, whether it's in the with our universities, or whether it's with our businesses, or whether it's in our healthcare workers. The more people who get vaccinated, the better we're going to be in terms of recovering from this pandemic. I know that you've worked hard to make that happen, and you know, the best of luck to everybody on campus this year. It's decisive leadership like this from URI and many of our colleges and universities here in Rhode Island that should make Rhode Islanders and visitors feel very confident, and all Rhode Islanders feel very proud of the ongoing COVID response and improved health and wellness in the state of Rhode Island that is being led by our Department of Health, as well as all the people that live in the state of Rhode Island, our National Guard, and all our teams that are working on this daily. But here at URI, the Rams are doing it right, and we encourage others to do the same. At 94% of students either partially vaccinated, I just heard 96, so it even come up from this morning, so 96% of the students are either partially or fully vaccinated to date, or with some level of exemption. Masks are required indoors, just like our public schools are, our K through 12 are. There's a strong testing structure in place, and now even more people on campus will be vaccinated. These strategies are going to help keep Rhode Islanders healthy and allow students to be safely back in the classroom. And what does this mean on a statewide basis? All our universities are following the lead here at URI, and actually they stepped up at the same time as University of Rhode Island did. We're going to have an influx of thousands of students that are going to come from an out of state into the state of Rhode Island. Each and every one will be vaccinated. That is going to make their appearance here very, very healthy, and contribute greatly to our economy. Could you imagine what that would mean for this area of the state if the university was not in person right now, in terms of what that would mean to the overall economy of South County and the state of Rhode Island? And that's going to apply in every district in the state of Rhode Island as these students come in. Not only our students that live in Rhode Island, 62,000 of them, but also the 40 to 70,000 that are going to be arriving here over the next couple days from out of state, and also from other areas of the world. The science is clear. These vaccines are effective, they are safe, they help keep people out of the hospital, and they are the best tool to fight the Delta variant and keep our recovery on track. For everyone who has not yet been vaccinated, it is time. Many Rhode Islanders have already stepped up. According to the most updated rankings from the CDC and Health and Human Services, Rhode Island is number 5 in the country for percent of population fully vaccinated. And I would expect, with the cooperation that we're receiving, like here today, that we could even move up that list even quicker. 83.9% of Rhode Islanders of the age 18 plus have been at least one shot. And I still have in my eye on the 90% in our adult population. That's why we want to highlight institutions like URI for putting protocols in place that help get more Rhode Islanders vaccinated. Here in Rhode Island, we only have 162,000 people left to vaccinate who are eligible for vaccination, and significantly less than that in terms of reaching that 90% goal of our adult population, 18 and over, who will, that gets vaccinated. That means if you haven't got your shot yet, it's your turn. Follow the example of so many young people here on the campus today and get your shot. A few minutes spent getting your vaccine could save lives, keep family members safe, and keep family members out of the hospital. I want to thank again President Mark Palange for having us here today. Congratulations on all your hard work. On what day are you here? What day are you here right now? Oh, you started in 32. Yeah, so count down to 100. That usually works pretty good. All right. It's going to be a great and safe fall semester. So go Rams. And now I'll turn it over to Dr. Alexander Scott. Doctor.
Good afternoon. We are thrilled to be here. Thank you, Governor. Thank you, President, and the team at URI for hosting us today. We are thrilled. We want to really congratulate the entire Rhode family for everything you're doing to keep students, staff, faculty, and the community safe. You're setting an example for organizations, for businesses, for all communities throughout the entire state of Rhode Island to follow. I spoke with the Institute of Higher Ed presidents earlier today. I'm sure we'll be hearing more from them. They've continued to be at the lead along with URI about following these steps. It all falls in line with the role employers have to play here. We talked about it last week, and since then, the Rhode Island Department of Health and Rhode Island Commerce, along with the Department of Business Regulations, sent information and resources to employers throughout the state on these 4 key areas. What we're highlighting today: strong vaccination policies for your employees, accessing our testing programs throughout the state, implementing indoor masking policies as an important way to help stop the spread of the Delta strain, and ventilation. Those are the top areas. We know they can work. The data picture is telling us that we are going in the right direction. We're one of the few states that have started to see plateauing over the last few days and weeks. Those initially sharper inclines in cases and hospitalizations that we were seeing have slowly started to level off. And you know what that message is for all of us? Keep going. We have the tools. We've been talking about the tools. We shared it with employers, and employers such as URI and so many others are taking it and running with it, because then you can say, this is a place that's safe, that this is a place where we know we are doing everything possible. The fact that we were able to slow the exponential increases in cases we were seeing has a lot to do with activating these steps taken by employers, taken by communities, taken by the people of Rhode Island. That means wearing your mask in public indoor settings. That means getting tested regularly, and absolutely getting tested if you have new symptoms, whether or not you're vaccinated. That means taking advantage of treatment along with testing. If you test positive, call your healthcare provider or an urgent care center to be able to access that. And finally, of course, it means if you haven't gotten vaccinated, it makes a difference. Please get vaccinated today. These are the steps that work. Now is not the time to let up. We can not only keep this plateau where other places are seeing inclines, but with these mitigation measures that are strong and work, we know we can start to bend the curve downward. And it's particularly important now as kids start going back to school. So working together, implementing these tools, everyone can do their part. The last thing I'll say is healthcare workers. We know our vaccination requirement for healthcare workers is a place where we are all aligned in ensuring that people receiving direct patient care are going to receive it from people who are protected and vaccinated. All people engaged in direct patient care are required to be fully vaccinated by October 1st. We're not alone in doing this. We know this is an effective approach. The hospitals in our state have led the way in doing it, even in advance of the state, and the state's Planning on sending out the message today to the employees about the implementation of working this forward. More than a dozen states throughout the country are requiring vaccination for healthcare workers, and in Massachusetts, staff in nursing homes, assisted living facilities, and home care workers will be required to get vaccinated. It's everywhere. It's what works. These entities are taking this step so that we all together can keep patients and residents safe. Different groups have raised concerns about staffing levels. We hear them. We're talking with them. We're working with them. We want to keep the dates and help people do what they need to close the gap, make sure patients are cared for safely by people who are vaccinated, and get us over the finish line. We can exercise discretion, we can exercise reasonable flexibility, but ultimately, we need people to be vaccinated. All of our healthcare workers have been the heroes of this pandemic. EMTs, other frontline healthcare workers, they deserve our deepest thanks. They deserve our support. They have done so much for their patients. That's what healthcare providers do. They devote their lives and careers to helping others stay healthy and safe. That's why we've received such overwhelming support for this requirement, because it allows us to make the stance clear. We want to make sure that our patients that are most vulnerable are going to be cared for by those healthcare workers that care for them and want to make sure that they stay safe. This vaccination requirement among healthcare workers is one example of many about keeping people who are more vulnerable as healthy as they can, and frankly, about keeping them alive. That's been our critical piece getting through this pandemic, and we're going to continue going in that path together successfully. With that, I'll pass it on to Commissioner Gilkey.
Thank you, and thank you to President and Governor McKee for having our office here today. We want to really extend our congratulations to the faculty and AAUP for coming to this arrangement. You know, it's the faculty and staff of this institution and all others across Rhode Island that really make sure that teaching and learning happens in a classroom. And so by this next step in leadership to keep our campuses safe, it allows us to continue to do that across our industry. We also want to really restate that Rhode Island was the first state in the country to require vaccinations for all of our students. This is allowing us to take that next step along with our private institutions to reach where faculty and staff are also vaccinated, really leading the country in how that higher ed can lead the industry around the country for making sure that our campuses are safe and we can return to in-person learning and stay in-person learning. You know, I dropped my 4-year-old and 7-year-old off at school yesterday morning, masked, ready to go, and as a parent, I want to keep them in that classroom so that they learn, and I want that for all of our higher ed students as well, whether it's in a hybrid format or it's in a remote format or in-person learning, that we continue that education process. The governor said something that's really important. The vaccination is based on really good science. It's based on research, something that this institution leads in, as well as others in the state of Rhode Island. And so we need to have faith in that science and that process so that we can really move our state forward and move our country forward. Thank you very much. I want to turn it over to the Lieutenant Governor.
Thank you, Commissioner. I just want to thank Governor McKee again for bringing us all together, and also for making sure that the message is getting to our community. We have to bring the message as often as possible to remind everyone about the importance of getting vaccinated. I want to thank the efforts and the resilience of the students and the faculty here in the colleges, here in URI and other colleges of the state of Rhode Island, because they are resuming in-person learning. We are so glad to see that happening, but it's only happening because of all of you that are following the protocols, are getting vaccinated, and I'm also making sure that you're wearing your mask when you are indoor. It's critical that we continue to do this. I want to thank also Dr. Nicole Alexander Scott for the important message that she provided right now about the importance of getting everyone vaccinated. including those healthcare workers. They are taking care of our loved one. In many cases, those are the ones coming into our home, or in the homes of families, members that are the most in need. So we have to make sure that when they come into our homes or our relative homes, they are vaccinated to make sure that we're not spreading the disease of the Delta that is so contagious. In order for us to continue moving forward safely, we have to protect our community against the Delta variant. And I encourage all Rhode Islanders who qualify to get the vaccine to please get vaccinated as soon as you can. Each and every one of you has an important role to play in taking an active role in making sure that our school community is safe, that our families and friends are safe, and our fellow Rhode Islanders are safe. And again, I'm just gonna say a brief message in Spanish. If I spoke another language, I would do it in another language, because that is that important that we get this message across. Yo quiero decirle a todas las familias, a todos los estudiantes, recordarles que es muy importante que protejamos a nuestra comunidad. La variante del Delta es muy contagiosa, y tenemos que asegurarnos que todos los habitantes del estado de Rhode Island estén tomando las precauciones necesarias para asegurarnos que todo el mundo está tomándose la vacuna para evitar la propagación. Un mensaje para los empleados de los hospitales y otros centros que tienen personas con alto riesgo. Nosotros necesitamos que ustedes se vacunen, y la razón es porque ustedes están en contacto con nuestros seres queridos más vulnerables, y ustedes vienen a nuestras casas de personas muy vulnerables. Es muy importante que usted reciba la vacuna. Usted no quiere sentirse culpable de haber sido la persona que llevó esta enfermedad a un hogar y que causó tal vez que una persona que usted ame termine en el hospital o que lamentablemente muera. Nosotros no queremos ser responsables de eso. Así que, por favor, vacúnese, porque usted está jugando un papel muy importante en cómo nosotros podemos parar esta enfermedad del COVID. Lastly, I just want to once again remind to everyone to get vaccinated so we can enjoy great events and we can come back here at URI and also be sharing on for the Rams because that's what we like, right? So with that, I just want to say thank you, and I want to turn the speaking program over to Laura Won, Doctor of Physical Therapy student. Thank you. Thank you.
Good afternoon. Thank you so much for being here. I want to take the time to thank the governor's office, the Board of Health, and URI for taking the necessary steps to allow us as students to come back onto campus in a safe environment given the coronavirus. It's been such a difficult year for us as students, and I really think that everyone here has taken the necessary measures to allow us to be here and feel safe and not have to worry about our health here while in classes. Being a doctor of physical therapy student, it's so important for us to have in-person classes, and by URI mandating the vaccines for our student, it allows us to gain hands-on experience not only in the classroom, but also in the clinics, working with clinicians and gaining that experience. I personally decided to get the vaccine to protect myself, my community, my fellow students. And it's really important for us all to do our part to slow the spread and stop the transmission of the coronavirus. So thank you so much for having me.
Spell your name for us, please.
Laura Wong, W-O-N-G.
Thank you.
Open it up to some media questions.
Thank you. Good afternoon, Governor.
I hear there's no backtracking from your message, that you're not going to backtrack from the insistence that healthcare workers get vaccinated by the 1st of October. And secondarily, there's an article in the Providence Journal today.
Today, we'll be meeting with him tomorrow, And he acknowledged that it's an issue that he wants to talk through with us, but he also acknowledged this one important stat. His members, his union members, firefighters in the state of Rhode Island, by the way, thank you to all our first responders for getting shots in the arms. We activated them, and he acknowledged the fact that I helped activate our first responders on 39 communities. They've grown, I think, up to 90% of the firefighters in the state of Rhode Island are vaccinated. So when we start talking about the people who are unvaccinated, we'll talk to them, and we'll see how we can help them get to the point where they do get vaccinated, and then where they can't, we'll continue to talk to them about the roles that they can play and to keep us safe in the state of Rhode Island.
And to follow up, if I may, and the students who are claiming an exemption from the vaccination?
Yeah, so and again, I thank the universities. The president may want to speak to that, but I thank the universities in the state of Rhode Island, as the commissioner said, the first state in the country to have all our universities put a vaccination protocol in for their student body. So, but it is each university that is working on their protocols. So they need to work through that in terms of what makes sense to them. But over 94% of a student body vaccinated at a university of Rhode Island, you know, I think that that'd be the envy of any university in the country, to tell you the truth, and we're very proud of what has happened here.
Mr. President,
Yeah.
if you would.
Yeah, thank you for that question. So it's very important to begin by saying that the University of Rhode Island is a very open and welcoming university community. It is a very diverse student and faculty community. And of course, we have people from around the world that also choose to come and study here. And so we believe that, and it is my strong belief that it would be inconsistent with our values of inclusion at the University of Rhode Island to question the authenticity of anyone's religious beliefs or philosophies. So we have a very strong testing procedure in place that we know the incubation period is 3 to 5 days, and it is for that reason that on Monday and Tuesday, folks will be tested on campus, and then again on Thursday or Friday, they will be tested.
I'm guessing you're vaccinated?
I am. Yep.
Governor McKee, last Thursday, the Supreme Court, in a move long predicted by
The legal community issued a judgment voiding the CDC moratorium on evictions. Friday morning, Rhode Island District Court revised the court's eviction protocol. But clearly, this is an overnight crisis that is over a year in the making. And while the offer to station Rhode Island housing personnel in housing court is generous, they'll have absolutely no legal authority to intervene in the proceedings in anything other than an advisory capacity. And it will certainly not provide relief to landlords or tenants. My question, threefold. How many man-hours currently are being dedicated to processing applications? What is the current projected time period between application and receipt of funds? And finally, is it time for Carol Ventura, the head of Rhode Island Housing, to step aside?
So I'll get you to the answers to those questions. Let's keep it to the COVID and here, and I'll be happy.
this is happening. People are about to be evicted because
So I don't have those numbers readily available, but we are working through those issues. As I mentioned on Tuesday, talked to the White House in terms of making sure that they understand that their restrictions on the application process is really slowing us down. And so we're doing everything that is possible, and we're going to hold anyone that needs to be accountable. And we're working our way through those issues, not only utilities, but rent and others. I met with people who are advocating for homeless today. There's no reason, again, for anyone during the COVID who is that is in an apartment to be evicted out of an apartment. There's money there. We'll make sure that they get the money. They should be making sure they contact our office if they're having difficulty on the utilities or rent.
quick follow-up, is it appropriate to provide a religious exemption to university employees and/or students, but not afford the same religious exemption to medical care workers who are being routinely denied that via computer-generated response?
Yeah, so that's a decision that'll be made by the state on relative to state policy, and then this will be a policy that the president has already spoken to, and I think he did a good job speaking to that issue.
Thank you. This is a question for you, Mark. I'm looking at this policy here that you're going to require vaccinations of staff by October 15th. And this is apparently is an agreement with unions. If they are not vaccinated, what will happen?
So, so we believe, first of all, I think this has been a policy that's come together in close consultation with the faculty, and so we know that there is strong support among the entire university community for this. In the instance where for medical reason or for religious reason that somebody is not, then what will happen is, as mentioned earlier, then there will be the testing procedure, and so folks will be regularly tested on campus twice a week.
Will people be dismissed if they cannot provide proof
Of,
of vaccination if they don't have a religious or medical exemption?
So we are going, so in that case, there will be options for, first of all, for quarantining and off-campus, but we will not be in a situation where we have people on campus who are refusing to get vaccinated and refusing to get tested. Yeah.
Two questions for Dr. Alexander Scott. First of all, ought there be a rubric for medical conditions or even for religious specific decisions or processes, or however someone comes to the notion of a religious exemption? Ought that be spelled out at this point very specifically so that it's not just used in the case of someone trying to circumvent a vaccine mandate in a particular sector? Is that something that the Department of Health will print and put out?
Yeah, it's a process that we're very familiar with. We've used it with many of our vaccines in terms of exemptions. For medical exemptions, there are very specific diseases that qualify. It's naturally rare, so it's even less common to have someone have a medical requirement that's beyond that, but we have offered support to any providers that want to reach out to Rhode for assistance with that. In terms of a religious exemption, it's obviously a little bit more complicated and the approach. It's why we really tout what Rhode Island has done well for years in terms of immunizing our populations, our children and our adults. And for healthcare workers, everyone wants to ensure that if your loved one or your family member has to come in encounter with the healthcare system, that you're confident you're doing that with a healthcare staff person who is vaccinated and protected. So that's really why we focused on just limiting it to the medical exemption and getting as close to 100% as possible for our healthcare workers, knowing the vulnerable population that they're caring for.
But are you concerned about that being exploited? Like, is there a list of here are the 10 conditions that qualify you for a medical exemption, and if you're not one of those 10, then you don't qualify? Are you concerned
Yes.
about that?
No, that list exists. We use it for all of the immunizations that we have medical exemptions. It's based on information provided from the CDC. We have a standard medical exemption form. And so going beyond that would require an actual clinical provider to determine qualifications. So there's less concern, and we know that most Rhode Islanders get it. It is important to get vaccinated. That's going to make a difference, along with the other mitigation steps of the indoor masking and the testing. That's what's going to get us through the rest of this and keep our loved ones safe, alive, out of the hospital. Those continue to be our goals.
And lastly, there's chatter this week that antibody being infected in the past with COVID-19 has the same or greater opportunity for one to be immune to COVID than the vaccine itself. It's being pushed by some elected officials, one particular medical doctor. Is this nonsense? Is this real? How do you feel about that statement in general?
The CDC and other public health experts have made it clear that natural immunity may help a little, but it by far is not enough, particularly with this current Delta strain. What you can be most confident in terms of immunity is being vaccinated for staying alive and staying out of the hospital. We are urging everyone, regardless of if you have had coronavirus in the past to get vaccinated, so you have that added level of assurance that you can be protected against an extremely transmissible strain of coronavirus.
Director, what are you hearing from the hospitals about? Are they preparing to lose staff over the vaccination issue? Are they going to terminate people from what you've heard who do not comply?
We've had a strong working relationship with the hospitals. We've actually applauded the hospitals for the work that they've done, and they've encouraged us. This is the route to go. We want to be able to ensure that any patient, any family member can know when they step foot in our doors, they're going to be encountered by a healthcare worker who is protected and vaccinated. And so they have done everything to engage the healthcare working staff, to ensure that the majority of their population is vaccinated, and they've done everything to account for if there are, unfortunately, healthcare workers who don't have that same belief of ensuring that any patient they come before, they are doing everything they can to keep them safe. They want to bring in the folks who do have that belief and who do support the importance of making sure that all patients, especially the most vulnerable, are safe. So hospitals have been leading the way on this. They have been behind this approach, and we're standing firm on that October 1st time and working with everyone to help ensure the impact is appropriate.
What do you expect to happen on October 1st, though? Will those people who do not get vaccinated lose their jobs?
We're hoping that no one does. We have really been pushing on the engagement and the education, but we're also making clear this is where we have to draw the lines. And we've appreciated the hospitals that are saying we're doing everything we can to make sure everyone has access to getting vaccinated. And if at the end of the day there's someone that doesn't have that belief of making sure every patient comes across a healthcare worker who is vaccinated and will help keep them safe, they want to, reassess that and see how to make sure we can all follow this requirement.
Governor, are you expecting other colleges and universities to follow URI in requiring the vaccine among faculty and staff? And are you pressuring any other institution, whether it be academic or otherwise, to do that?
Well, I think it's been pretty clear that I believe that local decisions are important, just like I did on the school masking. We got 95% of the school districts to agree to do a masking policy in their communities. I'll leave that up to the universities. I think just the evidence here today shows that it's a huge success for us here in Rhode Island, what's happened on the University of Rhode Island campus relative to keeping students safe, faculty safe, and welcoming them back to keep our economy rolling and keep our kids educated, right? We want our kids that are in the University of Rhode Island, whether from Rhode Island or from outside the state, to be stay in the state of Rhode Island, and they got to be here first to get the education to actually have that happen. So I'll leave the local decision to the universities, and we'll support their decision because I believe that, they're making very good decisions right now for us.
Okay, hi. This question is for anyone or for the governor. There was a report that there are hundreds of students throughout the colleges of the state that they're under that medical or religious exemption, so they're not vaccinated. Will that even help leveling off the spread of COVID on campuses, considering that hundreds of students won't get that vaccination? Or?
Yeah, that's the question from Dr. Alexander Stout. I would just say, if we get to 94% of everybody that can get vaccinated in the state of Rhode Island, if we could get to 94% in every high school and every middle school in the state of Rhode Island, we're going to be very pleased with that.
So if I understand your question properly, thankfully, the majority of people are vaccinated, which is critical. For those who are not, it's up to the school in terms of how they are handling it and ensuring, as the president shared, that everyone that's on campus that is interacting is protected as best as possible. So we really hold up the colleges and universities that are beyond the 90% mark and pushing towards 100, because that's the model that we want to strive for with employers, businesses, organizations, institutions statewide. That's what we want to push towards with vaccination, indoor masking, testing, and any other mitigation step that we know will get us through this third wave of the Delta strain. Thank you, everyone.